Today we welcome Vincent Devlin, Dr. Vincent Devlin from the Eisenhower Allergy and Immunology Clinic and from Eisenhower Health. And it is allergy season, which is nothing to sneeze at. And certainly a guy in your profession doesn't, sneeze at this. You take it very seriously. So obviously we had a lot of wet weather leading up to the spring. So are we seeing more in the way of allergens? Is there a lot more going on out there because of that?
Absolutely. When there's wet winter and early spring like there was this year, we see certain types of plants that are blooming that maybe weren't blooming before. People refer to this as a super bloom. We're also seeing a higher pollen burden in terms of spring pollen trees as well as grass pollens that are blooming right now that are affecting people with both allergies and asthma.
Okay, so what can people do to combat this, especially if you suffer seriously from allergies? It can be a real drain on your health and emotions.
Absolutely. Allergies can affect your sleep, your ability to concentrate, your ability to perform at work or school, and perform athletically. What you can do is there's many over-the-counter options that you can start with, things like intranasal steroids like Flonase, intranasal antihistamines like Astepro or Azolastine, and over-the-counter oral antihistamines. Common names are Zyrtec, Allegra, Xyzal, Claritin that people can try on a daily basis, and those shouldn't be as sedating as older antihistamines that kind of put you to sleep.
Yeah, some of those previous over-the-counter medications really just kind of zonked you out.
Yeah, absolutely. Nowadays we have plenty of medications that don't have those same side effects, so they can give you relief without that problem.
Now, at the Allergy and Immunology Clinic, talk about the services that you provide. If people aren't getting that the relief that they want or need from over-the-counter medications, what do they come and do with you?
Yeah, you start with some of those, or if you're someone that doesn't like to take medications, we can perform some testing to actually tell you exactly what you might be allergic to. Common things, household things such as animals, cats, dogs, dust, as well as pollens in the environment. We utilize that information to make some changes in the home to minimize your exposure to those allergens, and then sometimes we do allergy shots, which are a desensitization process, so that you don't have as severe symptoms, as frequent symptoms, or symptoms when your pollens are coming out or when you're around your typical allergens, such as cats or dogs.
Okay, so with things like the allergy shots that people take, how effective are they, and how long do you have to, is that something that you have to continue doing?
They're very effective. You'll see benefit once you get to your maintenance or therapeutic dose. At Eisenhower, we actually do a few forms of accelerated immunotherapy. We can get you to that dose a little bit sooner so you can see relief sooner. Once you're at that dose, we like you to continue the shots for 3 to 5 years. That's the amount of time that we know that if you continue on those shots, that you hold on to that benefit. So you can stop the shots after that time, you maintain your tolerance, and you outcompete your allergies.
Wow, so that can be, that's a lengthy period of time, but it actually serves as a curative. I mean, you're getting over those allergies.
Anything that's worth doing takes time and effort, right?
All right. Dr. Vincent Devlin, thank you very much. And if you are suffering from allergies, you might want to check in at their Allergy and Immunology Clinic at Eisenhower.